coming. I think we'll start quickly with there you go. 1 second, Brady. Delegate McQueen. Thank you.
Madam Chairman, I have two bills. Can I take House Bill 1670 first?
House Bill 1670, Delegate McQueen.
All right. Thank you, Madam Chairman and members of the committee. This particular bill is a bill that would allow pharmaceutical processors who are already licensed with the state to purchase tested bulk CBD from Virginia hemp. So essentially what this would do is allow those licensed pharmaceutical processors who are already allowed to dispense CBD or THCA from not only extracting that from cannabis, but also from industrial hemp. So the bill does require that the industrial hemp that they purchase has to comply with state and federal laws. In other words, it can't be a hot plant. It has to meet the legal THC threshold, and requires that the industrial hemp be tested by a third party prior to purchase, and has to meet the exact same testing requirements as set forth by the Board of Pharmacy for cannabis plant extract. So essentially, we're talking about patient access and savings. The thing that I particularly like about the bill is that it supports Virginia farmers and creates new product for those hemp crops that are already in the ground, and ensures that the product is in fact the same high quality product that we have mandated in the enabling legislation.
Okay. Any questions from the committee?
And I think there is an amendment in nature of a substitute.
Thank you.
It's not a drastic change.
So we have a motion to move the amendment.
Move the substitute.
Second.
And Madam Chairman, I'd say the changes you'll see, if we have the same copies, are lines 16, 17, 19, and then again over on 118 and 145.
Delegate, so the reason that the substitute came about, could you explain that a little bit, so we have the differences?
So, hold on. I don't have the original bill. I'm only working off of the substitute at this juncture.
Want it here?
Was it missing something in particular?
No.
Okay.
It's, hi, Ashley Allen on behalf of Dharma Pharmaceuticals. There's a couple reasons. One was the original bill included using the definition cannabis oil. That's been completely taken out,
Okay.
and referring back to the old definition of CBD oil essentially. And then also clarifying some language around the oil, so that the product would only be oil, it would not be the plant. And so we wanted to make sure it reflects that in the substitute. And also ensuring that it's specifically third-party testing that would have to be done by laboratories located in Virginia, and also in compliance with law, as the standards for laboratories may kind of be shifting this year, so we wanted to make sure that that was in here as well.
Other questions on the committee? Delegate Howard.
Man, just to clarify so folks really know, I mean, the cannabidiol, the end result, doesn't matter where it comes from, you're just classifying it between the cannabis plant and hemp and marijuana. And the only difference is the THC amount in that plant, but the end result, it's just gonna take more of the hemp to be able to get the cannabidiol. That's all you're basically doing, expanding it to farmers and allowing them to grow the hemp and increase agriculture. And
Yeah, it's
because you can smoke 10 acres of it and not get high.
Correct. That's correct. It is a lower amount, and you still, when it's all said and done, still cannot exceed the limits that are already set forth.
Are there members of the audience that wish to speak for this? If you want to come up and state your name and your position briefly. Thank you.
Adam Gores, on behalf of Columbia Care and the Virginia Cannabis Coalition representing the processors. We support this measure. We think that it goes a long way towards protecting and preserving the safety and quality that you put into the program, as well as opening up opportunity to farmers, and I think it's a win-win for everyone.
All right, thank you so much. Hi.
Hello, Madam Chairman. Thank you. I'm Michael Johnson from Dharma Pharmaceuticals. I'm the pharmacist in charge. We would like to be able to purchase bulk CBD oil so that we can use that in the product that we make and be able to do different combinations and have quicker access to CBD oil for patients that lower their costs.
Thank you so much.
Mhm.
Okay.
Good afternoon. Jen Michelle Bedini on behalf of Virginia Normal. Happy to support the bill specifically because of the required third-party lab testing. Thank you.
Thank you. Are there members of the audience who wish to speak against?
Actually, I want to speak in favor.
In favor.
James Pickrell with Greenleaf Medical Virginia. We're the pharmaceutical process for HSA3 and we support the legislation.
Thank you.
No, sorry, Ashley, we just had a few folks that wanted to say they support that couldn't be here. The Institute for Advanced Learning and Research in Danville, they're doing hemp testing in this field and they're excited about this prospect. As well as True Harvest Farms out of Christiansburg, a large hemp facility, Clinch Valley Hemp, and then also the Cannabis Business Association of Virginia.
Thank you. Delegate
I have
Bristol.
a question for,
Yes.
just a quick question. Why did we remove the definition?
For cannabis oil, because that included a number of different things that weren't already in here, including some different THC limits and things that aren't currently in the program. So this is just for the current way that we can do it, but adding in the ability for us to purchase the oil from hemp.
Any other members of the audience? All right. Committee.
Speak against that.
I asked. Nobody did.
Okay.
So committee operates by motion.
I move that we report the substitute.
Second.
Okay. Can I open the roll? Passes out 4-0. Over to Quinn. Do you want to do your next bill?
Sure. I have House Bill 1460.
And the substitute for this?
Yes.
Paper business.
All right. Thank you. Motion to move the substitute?
So moved.
Second.
All right, delegate.
Thank you, Madam Chairman. So, House Bill 1460 is a patient access bill that would do two primary things. Number one, it would allow Virginia licensed and registered practitioners to utilize telemedicine to certify patients for medical cannabis. So, obviously telemedicine, you all are familiar with that. It's something commonly used by doctors, dentists, CSBs. I mean, lots of entities utilize telemedicine. And so current law allows a practitioner to recertify a patient for this program via telemedicine. And you can actually initially prescribe a multitude of opiates that are not held to this particular restriction. So basically in more rural parts of the state, prospective patients, that they're having difficulty locating a practitioner near them who will do this. A lot of them are squeamish about still being a DEA Schedule 1. You've got other issues attached to that. But really, if you take HSA 3, which spans over 13,500 square miles, you have 7 registered practitioners, which is a very low ratio for the amount of miles and the number of people. So, obviously this was put into place to help blunt some of the very negative impacts of the opioid crisis. And so I feel like that by doing this, we're going to help get these products that can help replace some of the really awful opiates and painkillers and make it simpler to do that. The second part of this bill, though, allows patients who are in Virginia, as opposed to Virginia residents, to be able to access these products as well. So current Virginia law says that you have to be a Virginia resident to be able to get this. What that doesn't take into account students, people who are snowbirds, people who may be here on a long-term work assignment and are perfectly eligible to be treated in Virginia, but may not technically be eligible to participate in this at this moment. And again, it's really an access issue for anyone who is here for any extended period of time.
Bill, Quinn, I have a question.
Sure.
I think the only thing that sort of gives me a little pause, and I don't know if you have some better definition, but when it, I'm not really sure what it means when it says the practitioner also uses professional judgment to determine the manner and frequency of the patient care evaluations to employ these telemedicine. It just seems you know, telemedicine for the purposes of prescribing is not necessarily widely something that people are comfortable with necessarily in Virginia. I think I'm just trying to determine if there's any criteria around this at all that, or if there's been any discussion around that to define it a little more specifically. Oh, hi.
Hi, Madam Chairman, I'm Caroline Curran, yes, Executive Director of the Board of Pharmacy. This actually is an issue, we do not have a position on this bill, but that is an issue that we have a little angst over, and so we are wondering if it is the pleasure of the committee to go forth with a provision for telemedicine, if it could be amended to say the use of telemedicine consistent with federal requirements for prescribing Schedule 2 through 5 controlled substances, because to your point, we don't really speak to what constitutes telemedicine in this new world of cannabis. We have reference to telemedicine with respect to prescribing Schedule 2 through 6 drugs, but these products do not fall into a Schedule 2 through 6 category. So we agree that there might be a need to flesh out what does telemedicine look like in this environment.
Questions from the committee? Doug and Howard?
I do, and if I may, I mean, you do control the prescribing of 2 through 5, 6 drugs with telemedicine, but you also have authority over the pharmaceutical processors now too. So why
Correct.
wouldn't it somehow encompass it there? I'm just
Because the telemedicine is in 54.13303, and it specifically references the prescribing of controlled substances, whereas this is not a controlled substance. Cannabis is not scheduled at the state level. It's a Schedule 1 federally, but it is not in a drug schedule at the state level, so the provisions currently in the law about telemedicine do not apply here. So it is our recommendation that you associate it with the requirements that would be in place federally for prescribing a Schedule 2 through 5.
Delegate Quinn, would you consider that a friendly amendment?
Madam Chairman, I think so, and is the language, I don't wanna get into cross discussion, but is that language already in the code somewhere in the other code
Yes,
sections?
54.13303,
Yeah.
subsection B is in boy.
I think as long as it's consistent there, then that should be fine, Madam Chairman.
So do we have a motion?
I'll make the motion.
A substitute? Are we doing a?
an
It
amendment.
could be a line amendment to a substitute.
We're amending the amendment.
Yes.
Move along.
Second.
Other questions from the committee? Are there members in favor or against who have not spoken, that would like to speak? Yes, sir.
Michael Johnson from Dartmouth, and thank you, Madam Chairman. In a phone calls we made today, in HSA 3, we have 62 registered providers for THCA and CBD oil. Of those, 7 confirmed they would make recommendations to patients. The others said they would not, although they are registered. So as you can see, for a 13,810 square mile region, 7 providers are not sufficient.
Understood. Thank you.
Thank you.
Madam Chair, members of the committee, Chairman Shalpadini, Virginia Normal, anyone who's sat next to me for more than 20 minutes has heard my phone ring off the hook, and it is patients calling the helpline all day long because they cannot find a practitioner. This would certainly alleviate that. We participated in that call project, and to hear 7 out of 60+ practitioners was pretty devastating. The problem is not that facilities aren't open. The problem is that every health system in the state has issued a do not participate letter to their practitioners, and that's not going to resolve when facilities open. So unless you're willing to cash pay to practice in Northern Virginia or Richmond, you're kind of out of luck as a patient.
Thank you.
Just
Delegate Hodges.
quick question, if you don't mind. I mean, what we're seeing out there is unregulated products being sold everywhere, and people getting advice at service stations and so forth. So this basically would open it up so people would have access to get the advice they need to use
From a
the
registered
regulated
source.
products and to know what you're getting.
Right, from a healthcare practitioner registered with Board of Pharmacy.
Gotcha. Thank you.
Adam Gores again on behalf of Columbia Care and the coalition. I may say another strong and important reason for this is mobility issues. We expect and estimate that the average patient in Virginia may be something around like a 57-year-old, probably skews female. And we're talking about walkers and wheelchairs and people that are immobile, and parents that may have to travel long distance to come register. So for those reasons, we support it as well.
Thank you. Sir?
Aaron Lopez, on behalf of the LITSO, the Northern Virginia processor, we have a patient population up there where we have people coming into the area that are staying for long periods of time but aren't necessarily residents, and we want to make sure that while they're away from home that we can go ahead and treat those patients as well. Thank you.
And once again, James Pickrell with Greenleaf Medical Virginia, we also support the bill.
Thank you so much. All right. Any further questions? Committee moves by motion.
Move to report the substitute as amended.
Second.
All right, so open roll.
Thank you, Madam Chairman.
Delegate Simon?
Thank you, Madam
Good
Chair.
afternoon.
And board. HB 691 establishes a prescription drug affordability board and is based on legislation that was passed and signed by the Governor of Maryland last summer. During my campaign, I heard over and over again about citizens worried about the high cost of prescription drugs. These weren't just worries, they were fears. Fears of losing a job and then losing your prescription drug coverage. Fears of losing your insurance coverage when you move. Fears of having the cost of a prescription that you depend on suddenly go up in price and become out of reach. And we know that right now 23% of Virginia residents stopped taking medication as prescribed due to cost concerns. This bill attempts to increase government oversight over this essential public good. I'm afraid in Virginia we've really let this area slide, and we owe the citizens more control over prescription drug costs. HB 691 establishes the Prescription Drug Affordability Board and the Office of the Prescription Drug Affordability Board. It hires and supervises an executive director, collects revenue, collects, reviews, and studies information regarding prescription drug pricing, publicly available information, hears justification from drug manufacturers and everyone in the supply chain, including PBMs. It recommends and sets appropriate payment rates for reviewed drugs and offers recommendations to the General Assembly to mitigate the impacts of high-cost prescription drugs on Virginia's residents and healthcare system. And I am happy to take any questions about this really important effort to try to get some control over what's happening with prescription drugs.
Thank you, Delegate Simons. Questions from the committee?
Looking at-
Clear as mud? Yes,
It's
Delegate.
clear, and it's just a lot is going through my head, and I've talked to you about this, and I applaud you for what you're trying to do, but there's a lot going on in here. And I'm looking where it was. And it only allows for access to public information.
Yeah, it doesn't.
And that's not, this is a sizable investment. I mean, there's huge fiscal impact. So just getting that public information with it, getting down the root of the problem, isn't gonna get you where you really wanna go.
Madam Chair, that's a very good point. This does rely on publicly available information, and it would be really good to have a transparency bill which would require the reporting of drug pricing, and that then could be fed to such a board. So I have heard from some stakeholders about issues with the board, and I'm happy to take some of those on and see if we can improve this bill to continue it for, maybe the next session.
Delegate.
And this is a question for information purposes. Doesn't Delegate Guzman have a study in to kind of lump a whole bunch of things together to be
She does.
looked at? And wouldn't this be something that we would consider sending to her study so that we're not doing a piecemeal kind of attack of this
That's another
subject
option.
area?
Very
And
good.
then that way, it can also be incorporated into what they're gonna be looking at as a whole versus then coming out of her study, you know, the information on her study, and then having this other piece that we're gonna bring back and say, oh, how does this plug in? So I think from a perspective of them being able to look at everything,
Yeah.
that would be, I think, maybe a better approach, if she's willing to do that.
So, Madam Chair, my only concern is that I have been presented with many studies that have been done recently by the General Assembly, and I have gotten some really valuable feedback from some of the drug manufacturers, and I would like to start the process of actually incorporating that into the Drug Price Affordability Board model, so it's ready, just in case they actually manage to pass some of these transparency, that will feed the information that this board would need in the next session. So, you know, I think carrying it over and giving
So
me
rather
a
than a
chance.
letter and go to the study, you'd rather carry it over,
Carry
work
this
on it on your
over.
own, take your chances to see where it goes, that kind of thing. Okay, do we have a motion for carry it over? Or we'll
I move that we carry over House Bill 691 under Rule 22 for the 2021 session.
Votes for it. Okay, all those in favor say aye.
Aye.
Against? All right, Delegate Simons, thank you so much.
All right, thank you, committee, for allowing me to bring this and to start brainstorming about how we can fix this.
Excellent.
Delegate Davis.
Yes, ma'am. How you doing? Okay, we have House Bill 347, which there is a rather significant substitute,
Okay.
which you'll appreciate because it went from a whole bunch of pages to one.
Coming from you, but.
I know usually mine goes the other direction, so.
Okay, motion to adopt the substitute.
Second.
All right, and before we discuss if it's okay, I'd like to do a line amendment for this too, please. So we just had another conversation real fast. So if we can please strike in line 11. Let's see, do I need to get rid of the comma? I gotta put my grammar hat on. Yeah, I can kill the comma. Okay.
The
So
committee likes Oxford commas.
is that okay? Well, this isn't the Oxford, I don't think, so we're good. On line 11, please strike the from the comma after program all the way through the comma after oil on line 12.
The first oil?
Second oil, please.
Thank you. All right, Delegate Davis.
Thank you. So the reason for the substitute is, as y'all know, last year I had a bill in that would look at expanding the number of distribution points for a CBD oil processor in their geographic territories. So those that get the recommendations and need access to this treatment the most actually have access to that, are disabled and are elderly. Additionally, we needed to have more processors. We think the demand, and I believe the demand is going to go through the roof. And we want to make sure that there's enough out there when this starts rolling. But also there's some other things coming around as well. So what this bill does is, instead of putting all this through, which we realize there's a need for education to be done around this, to back off a little bit, put together a work group to convene with the individuals that you see listed herein, to come together over the summer to discuss these items and look at potentially bringing back legislation in the 21 session that has all the stakeholders involved and can better probably provide a educated analysis for this body and the full committee as well at that time.
Delegate Davis, questions from the committee? Delegate Russell.
Delegate Davis, why did we have a substitute? Because I kind of like the original.
I did too.
And I'm just trying to figure out where the consternation was in expanding good work that we're doing here.
So I had a number of individuals that are vested in the program that are moving forward today with licenses and stuff that have significant concerns, and because of that, I thought I would like to at least continue moving things forward, as opposed to have to start from scratch all over again. So we could say that this is a little bit of a peace in the valley, negotiated outcome. I know it's the pleasure of the body, obviously, you know, with what's in front of you. But I'm with you, Delegate, and I appreciate the question. We need something, we need to make sure we continue to grow this program so those that could utilize this and come off opioids with this product have access to it.
Delegate Hodges.
Thank you. One, I do applaud you for trying to get folks together. The October 1st, 2020 deadline, this doesn't go into effect until July 1st technically to get it rolling. Is that enough time to get the work done?
So July goes into July 1st. That's a wonderful question. I believe so. That's only because last time I was part of a work group, I just said everyone would meet every couple of weeks. But I know, I think that's kind of I was a freshman at the time, so I know that's not usually how it
I've
works.
had the opposite occur.
Right.
So I usually try to extend like December 1st. Or
I think, well, December 1st doesn't allow us time to come up with the legislation and honestly bring everyone kind of, get everyone together. So I would say probably no later than the end of October. I wouldn't want to stretch you any time after that, yes, sir.
Delegate Rasool.
Yeah, I've been under the Madam Chair, question for the patron. I've been under the impression that, that the board, this is not a new conversation, and that we have, been under the impression that we were going to be expanding. We've been collecting information, and so I think this more formalizes that, and so to me this is, not a new, I know you didn't mean any harm, you were trying to figure out what the timing is, but I think we will probably know well in advance, and I think that's a great friendly amendment to November 1st, make sure that there's a lot, but I think that we should be able to come to a conclusion pretty quickly.
I appreciate it, and just to let you all know, the one piece that was most important to me, well, the two pieces in this bill, was one, expanding the number of locations for dispensaries, which there is still a bill out there in the Senate side that encompasses that coming over, and also making sure that we have additional producers. The legislation you have in front of you allows the RFP, or has the RFP being released for new licenses May 1st of 2021, and the stakeholders that I've been talking to have all agreed that regardless of, yes ma'am.
Is that, are you speaking to your substitute?
Yeah, the original.
Okay, but we're
oh, yes, ma'am.
considering the substitute.
Yes, ma'am. I was letting the delegate know that his desire to expand. All the stakeholders I've spoken with still agree to the same timetable of a release of the May 1st, 2021, or thereafter.
Delegate Davis. What will happen in 1 month? So what can you do in 4 months that you can't do in 3? There was some conversation about amending this again. Is there, given everything that you've talked about, instead of, it says October 1, there was conversation about November 1. Is there something substantial that will happen in that 1 month? Or
Oh, no, I'm fine. I was thinking no later than the end of October. November 1st is the same. Yeah, fine.
This says October 1.
Oh, yes, ma'am. And I was fine with the next 30 days. I just didn't want to go more than 30 days.
I'm just asking, is that necessary?
Oh, what?
The extra 30 days.
I don't believe so, no, ma'am. But I mean, I do, you know, so I think we can do it inside of, but it gives us the additional time. It still gives us 2 months to inform this body. So I'm not going to turn down 30 more days for the work group to come up with even a better solution or made out plan.
Right. Other questions from the committee? Other members who want to speak in favor, who haven't generally spoken in favor of this, or against in particular?
Adam Gores, on behalf of Columbia Care, I think it's great to bring together broad stakeholders to talk about these issues.
All right.
Once again with Delete, so this is something that we were pleased to work with Delegate on, and look forward to being able to come together and have this discussion to just an education factor more so.
Thank you.
Yeah, Jen Michelle Virginia Normal certainly would appreciate the opportunity to formalize the conversation and get
have a substitute, with a line amendment, and then there was some conversation about a second amendment. Are we making that second amendment?
I'm fine without the Second Amendment. If it pleases the body, if they want it.
Watch how you say
You
that.
don't like the Second Amendment?
Watch how you say that.
That's true, that's true.
We gotta say it on video. There goes your statewide aspect.
Yeah.
All right, committee moves by motion.
Move to report the substitute as amended, House Bill 347.
Second. All right, open the roll.
Okay about that.
All right, HB 347 reports out 4-0.
Thank you very much, Madam Chair.
Do we have Delegate Hayes or Superman?
Yeah, he's on his way. I'm gonna make a quick call real quick. Grab me. I'm still here.
So, we'll go at ease for about 5 minutes and wait for Delegate Superman.
do this. So, I just did the amendment to 14 so far, I don't know. So far, we've substitutes for 1670, 1460, and 347. So I'm doing, we just added the amendment to 1460. Federal requirements.
Yeah, I think
Yeah, this subcommittee will be done for the year. Well, we might have one meeting.
You might have to come back. Maybe. I don't know what your schedule's like. I'm just gonna give you my practice.
Just have to suck it up and then leave it to the water.
That one's done.
Okay. Is that tomorrow? I was gonna be with David. He might need help in Senate. Or rehab. Yeah. I think he's still in general.
Yeah.
Okay. I might not even see him by the time we're done.
Are we down there waiting for quorum? Do I help at all? I mean, a little? Now we're back to quorum. We don't have a patron. Oh, who are we waiting for? Is he coming? I just saw him down in Labor and Commerce.
Okay, and Hayes, we were waiting on them, so we kind of shuffling.
We quit once they did here.
How is that labor sub or is that full?
It's full.
Okay.
So, but there are some bills that need the patron, like I need to be there for
I have
mine because
two
they
things
were.
in sub, so.
Oh, yeah, you got time.
Okay.
Subcommittee report, we have 15
Fantastic. Oh, he needs pizza.
I take him snacks. Whenever we finish our subcommittee, I go back and take him snacks. He's working hard, that guy. So he's been he's admin for 8 years, and then summer he moved over to Subcommittee. If you're the chief of health, so Tom is going to start with. And we hired either any person.
I wonder what the other day that he said that he had like 6 days. Yeah, you need to go. But I don't even know what to bring him.
I'm in the
You want me to do? Busy down there?
Yes, but I got some good news.
Yeah, he's on his way out.
One minute. Okay.
So Sana would be the medical cannabis industry and patients includes motion and the medical use. Okay, I can just pop it in just now, so you won't have, I'm gonna hand this out for everybody to click on, just so you know. So it's the, I'm gonna do it now, so I don't have to. Public safety, so it's the one person who administers. You take mine.
I might have some in my office, but I do know a lot of places you can go to bourbon or scotch.
Which means, okay, let me text Ron and ask him to go check the sheriff.
Superman. Okay, we will reconvene. Welcome.
Hi, how are you doing?
Good.
How are you?
Madam Chair, members of the subcommittee, thank you for hearing out this. The bill is HB 876, and I do have a substitute.
Motion to sign the substitute?
So maybe.
Second?
Do you need a copy? Do you want a copy of the substitute, just in case the line numbers are okay?
Oh, you have the line numbers?
Sometimes they print different, so just in case.
Oh, I think that.
Okay.
Thank you, appreciate it.
That's a little aggressive. He's not done. He hasn't even started presenting.
Oh, just looking to see if they were
They're just so excited and support it.
That's really,
These are all supporters.
that's really funny, that's really funny.
They don't hear this.
All right. I know what they really want.
All right.
And it'll be available online in like a couple minutes.
Oh. Delegate Superman.
Thank you. So, as you've probably heard from the news and from your constituents, prescription drug prices are skyrocketing, and there are a number of reasons for this. When you talk to people about it, and you talk to industry leaders about it, oftentimes there's confusion about who's responsible, why are prices skyrocketing, why are they increasing so much, and so manufacturers will tell you, well, it's because of PBMs. PBMs will tell you it's because of manufacturers. Insurers will tell you everyone's at fault, perhaps, or no one's at fault. And what we're trying to get at here, and what other states have done successfully, is trying to create transparency and bring transparency to the entire supply chain. So that's what this bill does. In consultation with the Department of Health, the Department of Health has said that they would be able to take on a transparency program like this. We're asking for manufacturers, wholesalers, insurers, and PBMs to disclose some key information about pricing. And so several states have recently done similar transparency measures. And really what we're trying to do is pinpoint exactly where the issues are with these price increases. And in some cases, find whether there's some anti-competitive reasons, for instance, or some bad reasons, and find the bad actors. I think there's a tendency to think that all drug manufacturers are bad and evil corporations that are trying to get you, but really some of these drugs are life-saving. They do cost a lot of money, but the money's a lot of times worth it in order to save a $200,000 surgery taking a $100,000 drug is absolutely worth it. And so we don't want to punish in any way the good actors in the industry. What we're trying to do is find some of the bad actors, trying to gather some of the data and make it public, make the average person who needs and relies on these drugs to be able to have that information. So I believe this bill's, you're going to hear a little bit about whether the data is aggregated, whether we're making people give proprietary information away. We've done everything we can. We've talked to every single one of these types of entities in the supply chain to ensure that the data is aggregated and that we're not forcing anyone to give away proprietary information. So I would be the pleasure. Would be the pleasure of the committee. I hope you will report this substitute and this.
Thank you, Delegate Superman. Questions from the committee? Delegate Hodges.
And I have Natalie from ARP as well to answer technical questions.
The
Happy to answer.
question compared to your original bill, the difference between this bill now and your original bill.
Yeah, and so just to clarify, this incorporates a bill that was in another committee, and I think I must move to incorporate.
Well, if you want a little bit of info, it's actually being referred to us, I think, as we speak, out of Commerce and Labor. It just couldn't get here in time for us to have it before the meetings. So if the intent is to incorporate, we can even do that in full committee once we have both bills before the committees.
But content-wise, it was to incorporate a bill that was introduced by Delegate Hurst. And I thank Delegate Hurst for the work that he did on this. He did many meetings over the course of the past couple of years to ensure that everyone felt comfortable. As you'll hear, not everyone's comfortable, but I think a lot of folks who are subject to some of these rules are at least comfortable with the language that we've worked really hard to put in. So
Delegate Russell.
I have a question for the patron, Madam Chair. Is this like a new process here in the States, or are there other states that have this kind of transparency measure?
yeah, so several other states, we talk about California, Oregon, Maine, other states have done this, and one thing that might be a little different from normal transparency bills is that it also has a review process. So if the Department of Health feels as though there's an issue with the explanation of a large price increase, they can ask the entity to come in and explain that, and that's been very effective in actually helping the drug prices.
Delegate Superman, do you have somebody from the Department of Health here?
Is anyone from the Department of Health here?
Joe Hilbert from the Health Department.
Do you all have a position on this bill?
There's no administration position on this bill.
Thank you. Delegate Hodges.
Thank you, Madam Chair. And this would be a pretty large undertaking from the Department of Health, so I guess the question would be, to state the game, I would think there would be a pretty large fiscal impact to do this.
Delegate Hodges, there is a fiscal impact statement public.
The original, did I say that?
I believe it's $250,000.
And with this, okay.
It was 375,000 the first year, and then 250 per year after that.
Delegate Superman, and that those expenses are directed at supporting the costs for BDH.
Yes.
Delegate Hodges.
Thank you, Madam Chair. And I'm looking at, and we're looking at consumers and trying to make data available to them. The only thing I really see in data available to them is the wholesale acquisition cost, which typically is available for brand names, and that's fairly publicly available now. And where generics really don't. I mean, you purchase at a whack minus, and then generics you purchase at a different. So it's really not addressing very much as far as consumers and information for consumers. And
Yeah.
I can answer that. I'm Natalie Snyder. I'm AARP Virginia State Advocacy Director. What what we would want from this bill, in addition to reporting the wholesale acquisition cost, is that the Department of Health would provide a publicly facing, easily searchable website that would take that aggregated data so that the public can go in and look at the price of a drug. We're requesting that the reporting be done 60 days in advance of any major price increase, so that say you're taking a drug and you want to look at the price and you want to see if it's going to go up, and that gives you at least a chance to go talk to your doctor, see if there's an alternative, see if there's another drug that you can take, just kind of make a plan for that increase. But that would be what the information would be used for.
Delegate Hodges.
And thank you, Madam Chair. And those increases aren't necessarily reflected, and I applaud you what you're trying to do, but that increase doesn't necessarily reflect in their copay amounts, because it's already established at a certain formulary, so the copay may not go up, and you don't know what the PBMs are going to do and change their formularies and so forth. So my concern would be, are you creating a tool that create problems with patients scrambling to find other drugs and changing therapies? Because it's an unknown world, and I applaud you for what you're trying to do, but there's some things in here that I believe would need to be addressed, and some of those concerns.
Certainly, and we would be willing to work on that. I mean, if that's something that you need clarification on, I can certainly get you more information on it and bring that to you.
Other questions from the committee? Are there members in the audience who'd like to speak in favor of this bill? Hello. If you could just state your name and your position.
Sure. Howard Estes with Scott Spain. I represent the Virginia Pharmacists Association. We support drug transparency and price transparency. We think this might be a good start, but clearly there's a lot of other elements with regard to the pricing of drugs and the drug price train.
Thank you. Are there people who want to speak against the bill?
Good afternoon. Thank you for having me. Tara Ryan. I represent the Association for Accessible Medicines. We're the generic and biosimilar manufacturers. And we oppose the bill, but we understand what the delegate's trying to do, and I think there might be some ways to work with it. As mentioned, there are other states who have gone in this direction, but the way that this bill is drafted, one, I agree with Delegate Hodges that putting out the WAC price doesn't really do the population in Virginia any good. What I think people want to see is what it's going to cost them when they go to the pharmacy, what their out-of-pocket costs are going to be. So putting something available like a price finder, because every time you go to the pharmacy, you could potentially pay a different price depending on what pharmacy you go to. That might be something that's more helpful, I think, to patients in the state. But looking at the way that the bill is drafted right now, the information that's going to be captured could almost entirely fall on generics. I think what the state is trying to do is look at what's driving prices and price increases that are actually going to have an impact on either the state payments or on patient out-of-pocket costs. And the way it's drafted right now, the 25 drugs that the state spends the most on by volume, by total spend, could all be generics.
Thank you.
So we are willing to work with you to try to figure out how to make this something that might be might collect data that's more useful to the state in sort of figuring out how to address the things that are actually driving costs.
Thank you.
Good evening. My name is Julia Worcester, and I represent the State Director of Policy with the Pharmaceutical Research and Manufacturers of America, otherwise known as PhRMA. We represent our innovative new brand name, new therapies and medicines that are on the market. And we are here with grave concerns about this bill for many reasons. But I would like to make a point of clarification on two things before getting into the meat of my remarks. That the Joint Commission studied this issue, among others, last summer and came to the conclusion that they were not going to make recommendations on this specific issue because it was so complex and would need further data and stakeholders' input on this. Second, the fiscal note is $350,000 a year, along with $275,000 a year every 5 years after that. I also would like to echo what Delegate Hodges said about would you potentially have patients seeing this information and then making a change in treatment courses because of this information that may or may not be as accurate as what you pay at the pharmacy counter, which is what PhRMA supports. We want to have solutions at the pharmacy counter, changes in benefit design, and that's really where we come down on our main part of opposition. Our companies agree that too many patients are struggling with their medicine costs. The system is broken, and we do acknowledge that. We're looking for ways to change the reimbursement for medicines, and it's important to look at the entire supply chain and how it's impacting the patients, because that's the most important part at the end of the day when it comes to therapies and cures. One of the most significant issues for growth of drug spending is actually that it's declining, that the price that patients are paying at the counter is going up. In fact, those prices have increased 50% since 2014. The slowdown in drug costs in part is because our companies rebate back 54 cents on the dollar back into the supply chain. That number in aggregate for the entire country was $166 billion in 2018. We're incredibly concerned that this is not getting down to the patients due to, again, benefit design. Discussions about cost and affordability of the medicines are incredibly important, but the notion that spending on medications is the primary driver of health costs is just incorrect information and ignores cost savings that medicines provide to patients and the overall healthcare system. Medicines lead to fewer physician visits, hospitalizations, surgeries, other preventable procedures, all of which translate to lower healthcare costs overall.
I appreciate your general message. I think that the message is received.
Absolutely.
Okay.
Thank you so much. I'm here
Thank
for
you.
any questions if you need them.
Thank you so
Appreciate
much.
it. Thank you.
Are there other people here that want to speak for or against?
I'd just like to say a couple more things, if I may.
Speak to the chair, yes.
We think that transparency in the drug supply chain is notoriously missing. We think knowledge of what is happening, how those price increases are determined, why they're determined, whether it's really truly due to research and development costs, if it's due to what PBMs are negotiating. We just feel like that transparency needs to be passed on to the public so that they can determine if these increases are rightfully so. There's no doubt that the drugs that these manufacturers are supplying can save lives. And while we look at efforts to, say specifically cap perhaps insulin, like they're trying to pass today, we realize that that can be praised for its immediate effect in the system, and the patient is paying less, but that's squeezing the balloon and causing higher premium costs in other parts of the system. So we're just looking to have transparency through this system so that we can have this data and see what we really need to do overall, whether it's the manufacturers, whether it's the PBMs, whether it's the pharmacies that really are responsible for these price increases.
That's all I have. Thank you. Delegate Superman, this is tremendous work. It's been a heavy lift to get this bill out the door, so I commend you and Delegate Hurst. And I think that we've heard, a lot of good reasons that we need to have transparency and reduce costs, and certainly prescription drug costs are a big problem for a variety of reasons. What has been brought to my attention, and something I would like to put forth, is that there has already been a decision to have the Secretary, establish a study to look at a more comprehensive approach to all of this, in which I think much of the work that you've already done would be highly valued, and I'm wondering if you might be amenable to having a letter sent to include the thoughts and ideas and work of this particular bill into what is the
Secretary is SJ or HJ 52.
The House Joint Amendment to sort of look at the comprehensive prescription drug an analysis to really come at this more comprehensively. Would that be something that you would be amenable to, or would you prefer that we just consider this in isolation?
I'm new here, so I'm trying to understand what that means.
It's a friendly way of saying that I think this is an incredibly complex situation and you've done yeoman's work. But in isolation of there are many bills that are sort of looking at attacking various components of the prescription drug cost problem.
Sure.
And it might be to everyone's benefit across the Commonwealth to have a comprehensive solution that might be derived from this larger look.
Okay.
Delegate Rasool.
So with that, Madam Chair, just trying to ask council if this is a directive that is already on its way, or if this is something that's got to pass first.
House Joint Resolution 52 is still before the Studies Subcommittee of the Rules Committee. I think that your next
might be to like enroll, or what would be the appropriate, to have consideration and,
So I think what you would need to do is carry this bill over for the year, and we would draft a letter asking the secretary to include consideration of these matters in that, at the same time as that study.
Delegate Superman.
Yeah, I feel like we studied the issue recently. We've studied it on some other states, so I don't know if a study is necessary at this point. But perhaps if it's the will of the committee, I'll go with whatever the committee decides.
Committee operates by motion.
Madam Chair, I move to report House Bill 876.
Fails to report. Sorry. Thank you.
Madam Chair,
Delegate Rasul.
I move that we continue having that motion fail.
Delegate.
1 second. With that motion failing, I move that we carry over House Bill 876 under Rule 22 with a letter.
Second. All those, agree?
Aye.
Can I speak to that motion real quick?
Delegate Hodges.
Applaud you for your work. I'm all about transparency. This is a complex issue. Just going through this, there are a lot of parts, and quite a bit of work can be done to do some things, and a lot of missing pieces. But I think it's at this stage, instead of investing the dollars and moving forward with something that's really not going to get us where we need to be, I think it's wise to go ahead and carry it over. Applaud you for your work.
Thank you so much. I appreciate it.
Thank you.
Do we need to open the roll? Oh, we'll continue. Okay, voice vote. Thank you very much. Thank you, Delegate. All right,